Thank you. So, as I have put up on the screen, there are some elements of conventional dentistry that I have put on 3 lines. Mercury is the third most poisonous substance after uranium and plutonium. Fluoride is almost as poisonous as arsenic. And finally, root canal toxins is a dead cellular protein and just as poisonous as mustard gas. So realizing that over the years as a dentist, I passed my examination in '75 and has been in clinical dentistry ever since, just with a few years of interruption where after being presented on a big conference in US for the realization of what kind of life a normal dentist lives in terms of mercury vapor and being handicapped on many levels, working with mercury vapor, I made a choice to leave dentistry for a while and then came back 2.5 years later. But being a dentist, normally trained, I felt after traveling to US that I had to leave dogma. I had to open up for meeting pioneers in other countries and being open and learn from elder colleagues who had went before me and taught me about the dangers of mercury, fluoride, and toxic substances from dead or root canal filled teeth. So in that sense, you could say that this entity plays quite a huge role in dentistry. Mercury filling being around since 1818, introduced in Paris that year. A couple of years later in England, the Smith brothers took the new wonder alloy mercury fillings to US, New York City. I believe it was in 1824. And in that introduction, the old dentist or the old school dentistry in US came to a clash with the modern dentistry. They used plated gold to heat it up and put it into the cavities, or they used different kinds of cement or extraction. That was the framework of dentistry at that time. Now they had the introduction of a totally new chemical. Over the years, things changed in my professional life, and I haven't put in an amalgam filling since 1985. After being a dentist, I went on to study at the university different social matters, science, political matters, to have more instruments in my box, so to say, so I could travel in US and other countries and meet the pioneers and read their books, make some interviews for lectures and other things. And today, when I see my clients for the first time, this is like a 90, this is this is from the 90s, slides and transparencies. It's not PowerPoint, but I hope you can bear over with me with the changeover of pictures. So new clients are much more than a set of teeth, regardless the position of the teeth. But as I have developed my way of practicing over the years, I see it as a window to the whole person. And I give the clients a questionnaire that will reveal different aspects of their life, their symptoms. So that will be the basis for a talk, an exchange of a communication on different values already the first time. So I've tried to see and invite honest communication on healthy lifestyle and problems between me and the client. And sometimes the client will arrive. This is quite healthy teeth. You can see harmonic positioned teeth. The gum is looking very nice. Could reflect a healthy lifestyle and a sound, stress-free personality. Could be. And the same person could also look like this 2 months later, having gone through a lot of stress. As you can see, swollen gum and high risk of blood coming from the gum, from the gingiva when you use your floss or sticks. And this can also reflect problems. I will come back to that in a chart later. But as you see, the front teeth relate to bladder and kidney. And often the bladder meridian will be the acute stress meridian, indicating that the person is stressed from his or her job or private life. And if that stress isn't healed, acknowledged, the gum can look like that. And if you can have a supplement in your advisor role to your clients, which is going beyond use your sticks a bit more or brush a little more efficiently, then they have a chance to realize that this is just a window situation. They have to look into their life situation to make this change to strong, sound gingiva. And sometimes when I open up like this, you can see in people's eyes, well, I'm being respected here for who I am. I'm not just a set of teeth and a victim of my dentist's possible choices, picking down from the shelves whatever material he or she as a dentist would prefer in my mouth. Here I can negotiate the material choices that I will experience along the way. The chart that they will see, I think I will learn this in a couple of hours. So walking around. So these symptoms coming from Colorado Springs of mercury poisoning symptoms, classical mercury poisoning symptoms. You just have your eyes run down. These 30 symptoms is a fundament for my questionnaire. So when they sit in the waiting room before they enter the clinical room, they say if they have acute symptoms of that or chronic, had them before. And then I can pinpoint the degree of a possible mercury poisoning effect in that particular client. Nå, undskyld. Det var. Sådan der. Så går vi videre med nogle lysbilleder. This is rare view, I would say, but in my late 70s in central Copenhagen, some people went to me in that situation, and of course this is a lot of suffering here. Not only calculus, but look at the gums and what that reflects in that person's lifestyle is sad. It's really sad. So that is marginal, I would say. It's rare we see that. And that's what's happening because of the bacteria. And often, whatever it's an alcoholic or having a poor lifestyle in terms of bad nutrition, the colon and the small intestine is in chaos, you could say, and that reflects the tendency to develop periodontal disease. And you have early degrees on the left and more severe degrees on the right. And on the right side, you see bacterial, you see calculus, including anaerobic, meaning living out without oxygen, anaerobic bacteria living in the depth of deep pockets, creating the toxins that I mentioned to you before from dead or root canal teeth. So they have mustard gas in their deep pockets, like situation. And these toxins can travel to the gum, to the bone, and also through the microchannels along the root side to the nerve and create infection in the nerve pulp. So these years, a lot of people talk about having no root canals. But as one of the pioneers in this field mentioned, at the same time, they have to realize that the same toxins are being created in the depth of the pockets. So they have to look at the periodontal disease in the mouth, but at the lifestyle also. German doctors and dentists had for decades declared on conferences that if you have turmoil in the lower part, in your intestines, it will automatically reflect imbalance in the mouth, in the jawbone, in the ligaments, in the gum, creating periodontal disease. And it's not cured with better brushing or using your sticks or flossing. So you could say wearing a cross with a center in the mouth is just a symbol of what many German doctors and dentists have claimed over the years, that up to, or maybe more than 1/3, maybe even 2/3 of the root cause of chronic diseases we can find in the mouth, as amalgam fillings, root canal, deep pockets in periodontal disease, dental focuses, inflammational focuses under the teeth. Another thing called cavitations, which are infection or sterile, which can be an aftermath of extraction where you don't clean the bone. So the gum heals over, and you are left with what could be a cystis. But it's in English language it's called a cavitation, and you can see it on the X-ray picture as the overview. And that creates a interference field with the rest of the body, as well as a root canal or high-level current on an amalgam filling. So cavitations can actually be quite unnoticeable in normal dentistry, but have a huge impact in biological dentistry. And we have to clean out those areas of the jaw. So some of my clients, some of these are from Hal Huggins, one of the American pioneers among biological dentists. This could be a person suffering a lot, but she's not met by the different professions. They can't explain what's wrong with her. And finally she knocks on my door or Hal Hugginson's door and said, I suffer from this and this, and you saw the chart before. And most therapists or doctors or cardiologists or even the priest or psychologists or psychiatrists can't explain. Maybe they start treating her, but it's off the point. So if they can find the bullseye, or you can identify a mercury poisoned person, then this person have opportunities. And you could say that this person, from an okayness, where there's a balance, if the immune system is represented by a glass of, say, medium height of stress in this person's lifestyle, someday, the day after a night out or whatever, you have a chemical system. I mean, if there's stress in that person's life, suddenly the next morning, a person can wake up with a headache or other severe pains, or because the jar is overloaded, and we have a clinical system. And that goes for mercury poisoning as well. What a lot of people nowadays look at as a possibility is to empty the glass and have a more easy walk on earth in terms of living on many levels, psychologically, chemistry level, detoxify oneself. So we move towards a situation of a lot of healing ability. This is a tooth in the lower jaw. It's number 6 in the left side. I'll just like to tell you one practical story from the clinic, and I will have a few of them along the road here. But one day, during our clinical day, one of my clients, I have seen him, he's about 40. He was sitting in the waiting room and I was busy, and my clinical assistant went out to him and saw him sitting like that with his hands sobbing. He was in deep pain, and he told her that he just came back from a travel with his wife. Okay, so I finished my client and he came in, and he was sitting there and said, well, I will take, it was really painful, and it was with pressures on the tooth, it was bad. It was really bad, a lot of pain. So I took an x-ray 5 minutes later. No problem as such. No swelling at the tip of the root, indicating a bacteria or inflammation in the pulp. So I said, well, now you're here. You can expect that we can talk about things. So what has happened to you? And then his tears went like this. He told us, that he just came back from a travel with his pregnant wife. They were going to be married the following weekend, and in northern Germany, they were exposed to a car crash. And he was in deep shock. And this is possibly the day or two after this took place. And telling me that, and me pointing out to him that that particular tooth relates to the colon, left side, and the rest of the colon, and the anus, all the way down there, and this part of the shoulder, elbow, lower back, lower neck. And while speaking to him, that also the colon can be the way where the place where we store emotional patterns, shock and other experiences. Suddenly he cleared up in his eyes. And 10 or 15 minutes in the chair, and about 20 minutes all in all, after his entrance to the clinic, he went away. No pain, happy, and having integrated his experience. So what I would like to use this example for is, this guy would possibly have an opening to a root canal in many dentist offices right away because of the pain level. No discussion. So another dead tooth following a traumatic experience in a car crash, being solved by acknowledging what had happened, the amount of pressure towards the marriage, the wedding, the woman being, or his lover, what is that, kæreste, being pregnant, all that pressure in one toothache. And it just lived in 15 minutes. So a window to the whole person on many levels. And as you see, we have the pulp with the nerves and the arteries and veins. And we have the denture, or the dentin, with all these tubular system, and then you have an enamel on top. So it's a living entity, and fluid is moving both ways. Dentists will know when they prepare a tooth, they drill into the dentine, and there's a sign of liquid. They have to dry the surface to go on with their procedures. So sometimes there's a fluid movement from the inside out, and other times, particularly when there's a low pH, acid pH in the mouth, there is an intake from out with the fluid through the enamel layer and through the tubular system to the pulp. And if that, say, pH level 2 or 3 is a reality in the mouth for maybe years, you can imagine that this low acid-like intake of fluid system will stress the pulp over time, creating inflammation. So to balance out one's saliva pH would be quite appropriate in many aspects. Clients having amalgam fillings for many years, they have often a very low pH, maybe 4. The normal is 7. And the bacteria in a mouth with a pH of 3 to 4, 4.5 would be quite aggressive bacteria, creating cavities and periodontal disease and gingivitis. So consider your intake of sugar, of course, and maybe you could also have some buffer from sodium bicarbonate, natron på dansk. So you balance cellular acid accumulation in your body. And then the chart. This is an English version, and it's without a lot of details, but it's a basic chart used by more and more holistic or biological practicing dentists around the world. In the Western countries, I have met many at this point. And the chart is based on the work of Fritz Kramer and Rainer Voll. Voll was a leading German doctor, and Fritz Kramer, a pioneer in biological dentistry. And they used about 12,000 Germans, their patients, over about 8 to 10 years, and used electrical acupuncture, giving impulses at the area of the tooth and listening to how the body reacted. And having information from the hospital and X-rays, they came up with this chart about 10 years later. And we're talking about, say, mid-60s, end of 60s. I followed this man's work with his informational letter focus from early 80s, and in 85 we were a number of dentists who wanted to join and create a little society, and it became Society of Alternative Odontology, Selskab for Alternativ Odontologi. So we were about 25 or 30 at that point, and attracted people from Europe that we would like to learn from, and that was the start of activities like that. And the high sensitivity of the teeth and the gums and the tongue is mirrored by the representation on the gray matter. So you can see that the teeth, the tongue, and lower face as such takes a lot of place on the gray matter, both as a sensoric and motoric. So both ways nervous system is highly represented on the gray matter. In other words, the number of nerve endings per square millimeter in the mouth is the highest in the body. Maybe the thumb is quite close, as you can see. So the importance of the hand, and particularly the thumb, is quite high as well. This is one of my main pioneer inspirators. His book, It's All in Your Head, is the quintessence of his work after 25 years in amalgam-free dentistry. He would claim on his conferences, it's not all over the body or in the mind, it's in your head, it's all in your head. You have to look here. So he learned us a lot. We were a number of Danish dentists going to Colorado Springs in the state of Colorado, the years 88 and 89. And I invited him to Denmark in 89, in the fall. And we created a lovely weekend on Tidens High School with dentists and doctors and different professionals. And he's one of the leading pioneers in this field. And here at his own clinic, in his meeting room, his sword, the dragon slayer, as he mentioned. So he was quite a target for a lot of stress in the American Dental Association. Dentists attending his conferences wouldn't get the points that they normally obtain from going to a conference. His wife and children were threatened on the phone. His $1 million microscope was stolen from the lab. At this particular clinic in Colorado Springs, he employed 55 persons on the lab, different functions, testing, therapeutic aspects. His wife was Eastern-inspired, different Eastern relaxation techniques. So I would say there was a huge inspiration to go there and see the setup. And people would fly in from Canada all over US with their loved ones, often living in a hotel situation for maybe 3, 4, 5 weeks. And on a safe condition, having their amalgams removed, having blood test running, a nutritional plan, supplements, all that in a package, and all of it videoed. So when they came back to the rest of the family and neighbors, they could see, this is what I experienced. I am in a much better situation now. This is a man. If you want, you can go there. It costs such and such. And Hal Huggins. Yeah, sorry about that. At that particular conference, he also mentioned the work of Weston Price, one of our leading dentists ever, doing research together with doctors and other researchers in the 30s, traveled all over the world to find out the consequences of the introduction of white flour and white sugar on original people, measuring their bones, the facial looks and so forth. And from having rounded spherical faces, they would deform after a few years on white sugar and white flour. And that's all in the book. This kind of material where he actually extracted the toxins from root canals and put them under the skin of rabbits, so the rabbit would die of the same disease that the bearer of the toxins, the person. All that is described in his research programs. A clear brain, a lovely person, and Hal Huggins had integrated him in his nutritional education himself, Hal Huggins. And it was such a breakthrough for seeing the opportunities, just to jump from just being a no Mercury dentist to a more conscious one. Having a lot of instruments in your box to play with was enormous and very, very valuable. At that conference, I will just mention that that was a MD, a doctor, having researched on the dentist as a profession, and he gave a paper showing that when you have doctors, dentists, lawyers, engineers presented for psychosomatic testing procedures, the dentistry came way back. Even testing on the telephone, a seven-digit number, they had to go back, and even the manual, the motoric action would be quite unsure. So we have a profession here, highly influenced on the pituitary and the pineal gland, being at the mercy of the professors of his or her profession, having no chance to make he or her own discernment. The faculty has gone, or almost gone. So then they are just giving on to their clients, patients, what they were taught at the high school, at the dental high school. No dogma realization or leaving behind the traditional or the belief systems of conventional dentistry. And he also told that in terms of statistics, the dentists were way up there in divorce rate, suicidal rate, depression, all these classical high symptoms of a mercury toxificated person. And in terms of insurance affairs, they paid about 10 times the health insurance compared to a doctor, a lawyer, an engineer. So what we could call a very, very gray paper. And this is the kind of person most people use as their dentist, what they can expect from that kind of consciousness, beingness. It's sad, because if you are such a victimized professional, you haven't got a lot of good cards in your bag to play with. The faculty is very poor. So it's no problem to use amalgams, even now. Even though in Denmark we phase out amalgam, yes, but we have still an annual high number of amalgam fillings done. And it's also agreed upon by the Danish Dental Association and Sundhedsstyrelsen, the health department. Interesting enough, in the mouth, this amalgam filling is a proper material. It's okay, it's fine, it has its place. But the second I place with my pincet, take a little part of this and move it on my board with the instruments, it's become toxic material. And I don't want to touch it. It has to be carried in a container with a closed, sealed lid and with fixer, not even water, but fixer. So just a few fraction of a seconds before it was in the mouth, with the blessing of the societies of dentists and health professionals. So that's not science, that's dogma. So more and more people find out that they have other possibilities. So they go to the increasing amount of biological dentists in different parts of the world, also in Denmark. And in Denmark, we also have a society called DSUM, Dansk Selskab for Ortomolekylær Medicin, which have been part of for about 12-15 years, where doctors and dentists and a few other professionals meet quarterly to discuss, have invited lecturers, and inspire each other. And we have had from a clinic, a world-leading clinic in Switzerland, we have had Thomas Rau presenting with his dentists their work at the Paracelsus clinic in Switzerland, eco-sponsored seminars, 3-day seminars in Tønder a couple of years back, 3 years in a row. Huge inspiration for us in Denmark, and we at that point we hope to organize a similar situation with a clinic where doctors and dentists and other professionals work together. We haven't succeeded yet, but we can also exchange ideas from one clinic of dentists to a clinic of doctors. I refer a lot to Klaus Hanke, for instance, as a doctor in Copenhagen. I refer to different alternative therapists, not in the same building, but it doesn't really matter. As long as I know from personal experience that this particular resonance therapist has the knowledge, the intuition capacity to refer to, then I have a solid feeling of, yes, this referral gives meaning, and my feeling of that person would be, go to that person. Or, as you said to me at the table last night, if people have the need of clarifying which biological dental materials they were up to in their mouth. So we don't risk the fact that we take out the poison, yes, but we put in another, well, less poisonous, but still not all right material. So the Vega system, for instance, and other systems like that. Bianca told me last night you work in Aarhus and have people coming from a dear colleague of mine, Bent Christiansen here from Horsens, and help a lot of people in their way up to the amalgam exchange, choosing the right materials and detoxifying and having a nutritional plan that works all the way from the beginning and before and all the way after. So it's a safe procedure. It's liberating on many levels to make the right sincere choices where you prepare yourself really well. As they said at the conference in Colorado Springs in 88 and 89, to the people, don't run out of the door and have your feelings exchanged. That's not the way to go. Go on the net or whatever, make your right choice, go slowly, prepare yourself, feel that this is what you want to do, educate yourself, clarifying your purposes, tuning your willpower, and being ready to go when you have found the person that you feel in eye-to-eye with as a professional dentist, as well as a alternative therapist who can assist you on a similar level, life guides, for instance, right? It's a way of supporting the whole process because it involves all aspects of us. That's why I see a window to body, mind, and soul, or spirit. It does evolve the whole person. Talking about that, I would like to mention another situation where a person comes to the clinic, well-kept set of teeth and lifestyle, but four new big cavities in the mouth. Said, "What have you experienced?" And then she was crying, and the half or three-quarter of a year up to that date, her mother and her mother's sister had died, and she was in deep sorrow. There were 3 cavities in so-called long teeth, and 1 cavity in the upper left wisdom tooth, which is hard. So, well, often people in applied kinesiology relate stress of that kind, sorrow, to lung energy. So she was such a classical, and this all took place within, say, at most 3/4 of a year. When I told her that, something lifted because then she had the bad conscience of having 4 new cavities in a good set of teeth. So I could say, well, this is a natural consequence of what you experience at the moment. It costs to have deep sorrow. As we had a saying, maybe still have, that every child costs a tooth for the mother. But similarly, when we invest in a miracle as a woman, giving birth to a child, we invest a lot of spiritual power in creating a child. We take some of the capacity of the ongoing regeneration, the balance of the tooth. So also, do you degenerate or do you regenerate? So if we use all our power to create a miracle in our womb as a woman, we take some of the power away from the mouth. But this is that's another situation where sorrow is highly stressing this particular lady. And often when you lift that situation up to acknowledgement, you lighten up because then the bad conscience leave you. And it's just like life. Sometimes you're being pushed and stressed, and then you just have to realize, okay, I notice, I want to heal, I want to go with my sorrow and embrace it and do with it what I want. But now I understand. And that's a good first step for healing to take place. So as possibly most of us know, even though it's called a silver filling, often the professionals in US at conferences, they said silver filling, it's only silver. So there were doctors coming to those kind of conferences, having been practicing doctor or medicine for maybe a decade, being schooled at the universities, that didn't have a clue that over 50% of a silver filling was mercury. So far. So here we have the person again doing a little of the mixing compositions. But also over the years, even though the gold crowns it's an alloy, and you have low precious gold crowns like you find them in the Eastern European countries or Hong Kong or other places, and you have the biogold alloys that you can have from Germany. So you ensure yourself as a dentist and a client that when you change a person's tooth with an amalgam filling and it's need a crown, then you don't throw in another, say, high or low precious metal that this person will have intolerance reactions to the rest of his or her life. So get your material on the right spot, on the right level. So this is just what you actually can find of the ingredients in the so-called gold crown. Even porcelain crowns, even though they look light and bright, they have ingredients as you see. I have to speed up a little bit. Here we have the different immune reactions on the different dental materials, and aluminum is way up there. Sometimes people come, and this is some years back, where they have a temporary crown in aluminum, and they have a gold crown in the same mouth. And I can imagine, or maybe you can imagine, with the saliva as electrolyte, you have a huge current battery exactly in the mouth. And in a little while you'll see why, because I have some slides showing that they are in each end of the electromotive series. But look at that, if you sum up the quicksilver, the copper, the tin, and the silver, all those percentages, you have a sum of stress leaking out every second of the battery called amalgam filling. Even this looks nice. We don't really know what this particular dentist put in. So that's where I just repeat my point, that we have to be careful with the choice of composites. There are different composites on the market, and we have to make clear, and you can use the Vega tester, applied kinesiology, serum test. Hal Huggins used serum test a lot in those decades. He was active in Colorado Springs. You can also doctors' computers have similar programs to measure biocompatibility. Even the dentures, the acrylic, has ingredients that we have to consider, and they are now being low allergic or better tolerant materials on the market to create our dentures. Often we see different crowns and amalgam fillings, and when we see amalgam fillings on the right side here with a very high corrosion, we know, or I know, that this will create a very high reading. It's giving off a lot of metal ions, foremost the mercury ions. And that could be a question, does it come out of fillings? And yes, it does. And when you let researchers look at the consequence at the tip of the roots, you find that when you have a gold crown on top of a tooth with an amalgam filling, and you keep the rest of the part being topped by the gold crown, including the amalgam filling, you find up to over 1,200 micrograms per gram bone tissue, and this is way over where the bone cells die. So you have a total dead zone over such or under such a situation with a gold crown on top of another alloy with a little thin cement layer in between. It's a battery within the same tooth. But even with the normal, so-called normal amalgam fillings, you have often a few hundred microgram mercury per gram bone tissue, and it takes 1 microgram metal ion to create, eliminating the osteoblastic activities, which means the regenerative power of the bone structure. So a dead zone being communicated to the whole body is the consequence. So when we clean up this, the lymph activities, the other detoxing activities and qualities can actually be over time empty the residue in the bones, in the fat tissue, many places in the body, in the brain, the kidneys, the liver. But it takes a while, and it also depends on the well-timed program, the choice making, the sequence, the timing, the proper lifestyle changes, relaxation techniques, meditational techniques. It all comes to a movement that takes time. Again, this guy, and mercury vapor, often being from the mouth, you can actually measure it with a meter, and in the cavity you have often by chewing gum or drinking hot coffee or hot tea or warm meals, you have an increased amount of mercury vapor leaking from from the fillings, going straight via the clapless veins, 8 centimeter, and then you are at the pituitary area, and behind that the pineal area, and it goes straight into those glands, and stress they are ruling hormonal functions for the whole being. So that means, Mads, that I would like for you to start this, because I would like to show you an example of how important this Frank, is it? Here we go. I just think det went to the. Så tager den der IoT. So here we go. This one. Thank you. So an international organizations called, det var IAOMT, ja. Nej, den der nedenunder til venstre, den der. Smoking teeth poison gas. Der, tak. So we'll play a little sequence of this. And this is a tooth being extracted, and we are looking at a 25-year-old amalgam filling being...
All mercury silver fillings leak substantial amounts of mercury constantly. The amount increases with any kind of stimulation, and as a result, mercury from fillings produces the majority of human exposure to mercury. The International Academy of Oral Medicine and Toxicology is extremely concerned about the anecdotal claims of safety by manufacturers and dental trade associations that are at variance with the published peer-reviewed scientific evidence to the contrary. The precautionary principle requires action once the possibility of harm exists. It does not require proof beyond a shadow of a doubt that in the case of heavy metal and xenobiotic exposure is both nearly impossible and unnecessary, in our opinion. What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen. This is mercury coming off a filling that was dipped in water that's the same temperature as the human body. This is a filling that was rubbed with a pencil eraser for just a few seconds. Like going to the hygienist and having her clean your teeth. These are not small amounts of mercury. If you can see it, it's more than 1,000 times higher than the Environmental Protection Agency will allow for the air that we breathe. What about the last time you went to the dentist and they drilled on your tooth? Here is the mercury vapor every time you raise the temperature to 110 degrees with hot coffee or warm water, or even chewed on it. Mercury comes off fillings every time you stimulate them, and that stimulation causes the mercury to continue to leak out of the fillings for an hour and a half at a minimum. Some people grind their teeth. Some people chew gum. The dentist might send an old gold crown to the dental lab to be welded. How about the dental personnel? They're not being given informed consent. Back in 1985, the International Academy of Oral Medicine and Toxicology set out to determine the amount of mercury that was coming off fillings. And here's the graph, showing substantial quantities of mercury were measured coming off fillings. And then we estimated the total dose. And then we began animal experiments and put radioactive...
This reminds me of a person calling the clinic some years ago, having a really bad experience of having his teeth cleaned. And he asked my clinical assistant what has happened. And what he had experienced was an acute experience of mercury toxicity or poisoning with some of the symptoms that you saw before. And he was dizzy and aching and many things. And he asked for a reason. And said, what have you done? Well, yesterday I was to my dentist that had all my clean teeth. Do you have amalgam fillings? Yes, a lot. Okay. Another time, don't have your dentist to polish your fillings so they look really, really nice. Because at that point, they excrete a lot of mercury ions and the other ions that are in an amalgam filling. So that's the risk of being a proper dentist, not knowing what he or she is dealing with. In US, we have a limit on work fields on 50 micrograms per square meter. In Denmark, 25 micrograms per square meter. But this is often the situation when you remove amalgam fillings. You have to take the proper precautions not to poison your client, your patient, or your clinical assistant and yourself. So that whole procedure has been clarified by IOMT and also DSOM in Denmark. So we have procedures that we have to operate within. And does it form a toxic compound? Yes, it does, because the methyl group is often the methyl. This organic mercury is taking place in the mouth, but can also take place other places, organs, like in the stomach, with the use of bacteria in the small intestine as well, large intestine. Even vitamin B12 has been found to create or facilitate the creation of the possible 100 times more poisonous aspect of mercury, the methyl mercury. And this is also the aspect of mercury that passes the placenta membrane and goes to the feces from the mother, maternal blood circulation. And often we have from researchers seen that there's a factor of 17 to 19 degrees higher poisonous impact in the fetus bloodstream than in the mother's. So we're dealing with risk, and it makes a lot of sense when people think of creating family, that both man and woman have fillings removed to clarify the semen and the eggs so they can create beautiful children. An American doctor, Sandra Denton, working with Hal Huggins at that point, also been in Denmark a single time. She worked in Seattle, helping infertile couples, couldn't get children. And after having a local dentist removing their amalgam fillings and her being the advisor of detox programs, nutritional plan, they regained fertility and could create beautiful children. So, and here we see some chemistry in terms of how the aggravation of the methyl group can take place in different ways in the organism. And over the years, we have had these amalgam wars. I believe it was in the mid-1850s. In the 1850s, there was a clash of the old schools and the new dentists in US having a so-called amalgam war. We had one in the 30s, and we have had a few of them from the 70s on and on up through the 80s and 90s. So finally, like the Swedish initiatives and now on the EU level, the research groups finally declare that we have on EU level have to phase out mercury in the near future. But I mean, we have had initiatives in Scandinavia since the 70s, the 80s, and Sweden were possibly the foremost inspiration for other countries in that matter. Well, why measure current? Because oral galvanism battery function in the mouth is a reality, and you can have it between a gold crown and a silver filling, and between silver fillings, or you can have it within the same structure of an amalgam fillings, say a plaque covered side and compared with a grinding occlusal surface. So the more I can measure, or we can measure current, the more atoms or metal ions are released. And sometimes the dentist will jump in terms of surprise level. And here we have the chart of the electromotive series, where we see aluminum as the least noble, and as the most noble we have gold, and in between we have the ingredients of an amalgam filling. So here we have a cathode in a battery speaking, and the anode where the oxidation takes place, the area of corrosion. That's where we saw this on this side, the very dark amalgam filling, heavily corroded, leaking a lot of metal ions. And there, out of that situation in the mouth, we form a lot of soluble oxides, chlorides, sulfides, and mercury vapor. And out of that, and the hydrogen electron creation that takes place generates corrosion and low pH levels. Is that enough to create illnesses? Yes, it is. And his summary are different organ systems and function systems that he have found, like the chart of the symptoms showed, that it has a wide spread of symptoms. You cannot say that mercury poisoning is these two symptoms. It tends to be a situation for, as a neurotoxin, it goes to the weak spots in the genetic setup and exposes the weak card aspect. So, as a therapist, know your client and support the weak spot, so the immune status and the recreational power is optimized. Then you create good results. So what are the common immune suppression symptoms? And this is again from Hal Huggins. And you can see the percentages out of 1,300 mercury toxic patients. Depression very high. Suicidal tendencies, as I mentioned, with a dentist as a profession. Cold hands and feet, and also the tingling, numbness and tingling of hands and feet. Not good for a professional who lives from his or her accuracy in the handwork. No good. Here we have some where we suspect things to happen. Unexplained fatigue, I mean, that's a modern lifestyle experience, the fatigue level. And then at this point I will also add that since 2004 I went into the discussion of mobile radiation and all that, and started advising my clients to protect themselves. At that point you could actually buy a harmless mobile on the internet, and the firm was funded by 2 Danish lawyers going to US in the late 80s, early 90s, working on top of some experiences, some scientific research in the western US by Litovich, who helped the American Navy to balance out their radiation problems from the radar in the marine system. And he found out that if you put a biochip on the radar, you could modify the normal amplitude of the radar radiation, so it went into a chaotic characteristic, and thereby harmless. And all this was checked in laboratories in China, Europe, that animals in animal research could have their normal mental and motoric capabilities, when this kind of radiation would put as a climate around them for a testing period. Instead of having a normal mobile phone radiation deteriorating their mental capacity. So that is another adding to what we talked about last night. There are possible ways of trying to solve or to heal or to balance out that incredible radiation that we all... this is just what I mention it just here because over the years I saw that when you have a mobile phone on your ear and it impacts the brain and it destroys the membrane between the blood-brain barrier, so it gets like a sow insector. So the blood coming through with heavy metals and colors and other things from your lifestyle invades the fat tissue in the brain much more easily nowadays than before. Researchers at Lund Institute or University in southern Sweden claim, and have done that for about 10 years now, that they expect that the generations now that at the age of 6, 8, 9 have a mobile phone, when they reach their late 20s, many of them will already experience what's it called? A main brain, what's it called? Tumors, but also, pardon? Yeah, memory loss. Alzheimer, that was the word. Thank you for the key. I mentioned it before. Alzheimer's, think about it. Late 20s, Alzheimer. That's our future. Their faculty is gone. The mental faculty is mature at the age of 21. Their energy patterns are destroyed in their youth. That's our future. Well, so when Mercury adds to mobile phone use, because of the synergy impact on the pituitary and the pineal gland, we are in bad shape. And then over the years we have seen different animal experiences or research programs, also monkeys that having implanted amalgams in the jaw or in their teeth. That goes for the monkeys. And we see that these pregnant sheep, it passes through to the fetus, and all that is possibly more or less common knowledge now. But it was experienced in the late 80s and early 90s. Hal Hawkins did a research study, and this could be some difficulty in looking or clarifying, but you have the amalgam on the top, and you have from the clearing of a lot of research internationally, he found that different organ systems were stressed and created disease by the different contents of the amalgam filling: copper, mercury, tin, silver, and zinc. And when you have a dark spot quadrant, you have a problem with the kidney, the liver, the heart, the nervous system, the chromosomal, the birth defects, carcinogen, immunology, cytotoxic, behavioral toxicity, hematologic, and pulmonary systems are all impacted and stressed and diseased. If you go to the federal agencies and how they regulate on the same aspects of dentistry, you have in the top part, you have regulations on Safe Drinking Water Act, special regulations on your particular metal ions. So in the outer society, where EPA and other agencies work and assures certain amount of safety for the public, you have regulations, but not in dentistry. Here we have a picture showing, like I said before, we have a client that says, who wants to make a proper decision. We could do nothing, and the degree of disease or illness will fall, the life quality. We can add a gold crown to a mouthful of silver fillings, and we have detrimental impact of that, lowering the vitality. And we can remove amalgam fillings without the proper sequence according to the measuring of current, voltage, and microamp. So, and we can also replace random materials. So this is the wrong way to do it, like a lot of dentists do, random. Or we can take the more intelligent road, where we move them in the right sequence with compatible materials, with a general supplementation program, so the person is nourished and ready to go to heal on many levels, have these substances ready. And that could go into a special supplementation program. And he also added that if I have one person a Monday in the clinic, I wouldn't schedule the next visit 3 weeks later, Monday, because the immune system has 7, 14, 21 day circles, 7-day circles. So this person, 21 days later, would be low in immune system capacity, and it would be no good to go to the dentist and have another amalgam replaced. So, and then a future nutritional program assured that the person has learned from this whole experience. Sorry. I think that this will cover, well, I'll just take this. This is just white cells count, so it's lymphocytes and leukocytes in the bloodstream. And you see before, per milliliter blood from the first patient, we had a very high white cell count, which represents a stressed person with disease. We've removed the amalgam fillings, and 2 days after, it's from 16,000 per milliliter blood, the white cells, to 12,000 per milliliter, 12,700. So it's had an immediate drop of that amount, which indicates a less stressed person. And you can see the same picture with radical alleviation of the very high level of immune stress when you have amalgams in your mouth, represented by the very high number of leukocytes and lymphocytes in your bloodstream. That's just it. So this is just one of the final pictures of this section, just to indicate that the quadrant with the highest reading, that's where we begin. So there's a minus 16 on the upper right side. And then that would be the next, the minus 12, and so forth. So you can take one at a time, or maybe one and maybe one more. So the quadrant with the highest reading is what you do. And if the person have degenerative diseases and have quite a weak immune system, you take one by one, and you allow maybe a month or 2 in between to make sure that the integrational process has its time and function. Ja, tak. I would like to change into another aspect of fluoride, and I'll start with this Mike Adams, the health ranger from the naturalnews.com, who made a nice little the fluoride deception.
Fluoride. Dentists say that drinking it can protect your teeth against cavities. Cities and towns all across the world actually dump it into the water supply, hoping to indiscriminately medicate the population through their tap water faucets. The official story on fluoride sounds wonderful. Drink the stuff and you won't get cavities, we're told. It's a nice story. But there's another side to this story, the side you're never told. And it starts with the astonishing but verifiable fact that nearly all the fluoride dripped into municipal water supplies isn't naturally occurring fluoride at all. In fact, it's actually a combination of hexafluorosilicic acid and sodium silicofluoride. These two chemicals are considered highly toxic by the EPA. They're actually classified as hazardous waste, and when packaged for transportation, they must be labeled as poison and handled by workers wearing industrial safety gear. So, what are hexafluorosilicic acid and sodium silicofluoride, and where do they come from? That's the part of this story that you probably won't believe. That is, not until you check it out for yourself. Because the more you look into the mythology of fluoride, the more bizarre this story becomes. And this bizarre story begins at phosphate mining companies. Phosphate is an important mineral used in fertilizers. It's mined from natural rock deposits scattered across the world, and the phosphate rock is then refined to produce phosphoric acid. If that name sounds familiar, that's because it's one of the main ingredients in carbonated sodas, such as Coke and Pepsi. Phosphoric acid is often compared to battery acid. It's a highly acidic liquid that is believed to be the primary reason why drinking sodas can result in kidney stones and a loss of bone mineral density. Phosphate rock is also used to create fertilizers. The problem is phosphate is often contaminated with high levels of fluoride, as much as 40,000 parts per million, or up to 4% of the raw ore. To remove the fluoride, sulfuric acid is added to a wet slurry of phosphate and water. This causes the fluoride to vaporize, creating highly toxic gaseous compounds such as hydrogen fluoride and silicon tetrafluoride. These toxic fluoride chemicals used to be released directly from the smokestacks of phosphate mining operations, but the nearby farms suffered devastating losses of cattle and food crops, which withered away and died due to, guess what? Fluoride poisoning. In order to stop this environmental destruction, the phosphate mining industry put in place a way to capture the toxic fluoride chemical vapors so that they wouldn't be released into the air and kill the surrounding livestock and vegetation. This was accomplished by installing wet scrubbers that captured the toxic fluoride chemicals, preventing them from being released into the environment and killing the plant and animal life living nearby. It is from these wet scrubbers that toxic fluoride chemicals are now harvested. They're collected, repackaged, shipped to your local city, and then dumped into the municipal water supply. So instead of these toxic fluoride chemicals being released by the phosphate mining smokestacks, they are instead captured and then released into the water supply of large cities, where the chemicals then contaminate the water of millions of people at a time. This is called water fluoridation. When dentists and doctors say they support fluoride in the water supply, what they're really saying is that they support the mass poisoning of the population with a highly toxic, hazardous waste product that, if it weren't dripped into the water supply, it would have to be disposed of as a highly toxic, hazardous waste under strict EPA regulations. Curiously, it is a violation of federal law to dump hexafluorosilicic acid or sodium silicofluoride into the water. Such an act, in fact, is considered an act of terrorism. Yet it is mysteriously allowed today as long as it is accompanied by a loosely justified claim that we're doing this to stop cavities. But setting aside for the moment the inconvenient truth that water fluoridation involves the illegal act of dumping hazardous waste into the water supply, there's another important question in all this. Do these toxic fluoride chemicals actually prevent cavities? Roughly 99% of the municipal water pumped through any given city never ends up in the mouths of the people. Most water is used for showering, washing dishes, washing clothes, watering yards, and filling pools. Almost none of the fluoride dripped into the water supply comes into contact with human teeth. It does, however, end up downstream, where it contaminates rivers, streams, and ultimately the oceans of our world. In this way, water fluoridation policies have become a convenient loophole through which the phosphate mining industry can dump its toxic waste byproducts into the environment without adhering to any EPA regulations whatsoever. Phosphate mining companies even turn a profit by selling their hazardous waste to cities and labeling it fluoride, even though this name is scientifically inaccurate. All this raises an obvious question. If fluoride kills cows and crops and fish and is considered a hazardous waste chemical by the EPA, then how could it be healthy to ingest? And why don't doctors and dentists, even though they openly recommend fluoride, sometimes with irrational exuberance, know where fluoride really comes from? If dentists knew fluoride was derived from the chemical waste of the phosphate mining industry, would they still recommend that we consume it? The truth about fluoride is a lot like the truth about Enron or Goldman Sachs or every other shocking revelation that nobody believed until it suddenly became obvious that we were all being fooled for so long. Fluoride is a clever scheme where a hazardous waste chemical is dumped into the environment by passing it through the bodies of people first. We, the people, have become the toxic waste dump site of the phosphate mining industry, and chances are your local dentist fully supports this entire process. Over the last several decades, an astonishing 24 studies have established a statistical link between fluoride exposure and low IQs in children. One study conducted by the Center for Endemic Disease Control in China found that each additional milligram of fluoride detected in every liter of a child's urine was associated with a 0.59 point decrease in their IQ score. Another study found that fluoride exposure slashed the number of children achieving high IQs by more than 70%. It shouldn't be surprising, of course, to learn that consuming a hazardous chemical might impair brain function. Water fluoridation, it turns out, may be the root cause of the alarming drop in academic aptitude among children in first world nations. Historically speaking, the mathematics that were taught to 8th graders in the 1950s are now college-level courses in 2011. Maybe the reason why Johnny can't read or spell is because Johnny's been drinking too much fluoride. So I have 3 bits of advice for you. First, for your dental needs, always seek out a holistic dentist who understands the toxicity of fluoride and mercury. They will advise you not to drink toxic fluoride chemicals from your tap water. Secondly, don't drink unfiltered tap water. In addition to the toxic fluoride chemicals, tap water is also usually contaminated with chlorine and even dangerous elements from old water pipes. Buy a good countertop water filter from a company like Aquasana or get a whole house filter to remove chlorine and fluoride from the water entering your home. Thirdly, help fight water fluoridation in your local city or town. If your city is like most cities, water fluoridation policies have been pushed by dentists and doctors who are technically ignorant of the origins and composition of fluoride, and yet they seek to assert power over the composition of your local water supply. They essentially attempt to mass medicate the entire population with what can only be called a drug, a biologically active chemical that they claim can prevent a health condition. And yet, has this drug called fluoride ever received FDA approval as a drug? Have the individual members of the population been individually assessed for their need for such a drug? Have medication doses and drug interactions been considered? Has anyone even been written a prescription for this drug? The answer is no. Fluoride is an unapproved drug being used in a highly illegal mass medication scheme that provides an excuse for the real agenda of disposing of a highly toxic, hazardous waste chemical. It's time to stop fluoride. Demand an end to fluoridation in your local cities and towns. Call for those who purchase and handle fluoride to stop what they're doing. Question the safety of these toxic chemicals being dripped into the water supply. These are actions that endanger the public. They could be called acts of terrorism. And publicly shame the doctors and dentists who have taken part in this mass chemical poisoning, causing untold harm to populations all over the world. Help us stop the fluoride poisoning of our world. Learn more at naturalnews.com. Join the Facebook group No Fluoride. See more videos about fluoride at naturalnews.tv. Visit fluoridealert.org and other anti-fluoride websites that are working to end the fluoride poisoning. Together, with your help, we can end the era of fluoride in our world and protect our children from this industrial poison. Thank you for listening. This is Mike Adams, the Health Ranger, reporting for naturalnews.com and a nonprofit consumer wellness center.
I know that in Denmark we experienced rinsing programs with fluoride in the 50s and 60s. We have never had water fluoridation in Denmark, but we have a high recommendation from the dentist profession to use fluoride in our toothpaste. So what's the risk? High risk, even though it's only a toothpaste. But as modern researchers, for instance in Germany, experience that the energetic communication of things in the mouth communicate to the rest of the body, all the cells, with light speed. So if fluoride has a 1500 part per million in a tube of fluoride, in a tube of toothpaste, the presence of that fluoride will still immediately impact the person's cells all over the body, and it's only a question of accumulation of the proper level of stress, and you have the symptoms that was mentioned there. So for a number of years, from say the end of 80s, I have only recommended my clients, patients, fluoride-free toothpaste, and there are different ways to go. Veleda has a good one. There are difference on the market of natural toothpaste. Some people have over the years pointed at using soap in the as a mouth rinse to regenerate enamel. I haven't followed that road very much, but I know of it, and some people have tried it out. But there are a number of healthy toothpaste on the market in Denmark. So I'll recommend that highly. Time is running out. 10:05. I have 10:15, I believe. So I'll just finish a few minutes before opening up for some questions. When I change fillings from amalgam to composite fillings, I aim for optimal bite height. Learning from an American doctor who in the 40s and up to nowadays, I went to a workshop in Scotland in mid-90s. He had noticed the benefit of creating optimal bite height, because we are wearing down our teeth and fillings over time. So the line between C2, cervical vertebrae 1 and 2, and the tip of the top lower incisor, front tooth, is an organizational line upon which over and lower there will be 38 pair of muscles activated or working. And if we deepen our breath and we wear down our bite, that will create tension both locally around the TMJ, the neck, but also it has impact on the way the brain nerves are clenched in this area, and that would, for instance, for a woman, would create a lot of nervous vagus problems with her menstrual periods and digestion, of course, the whole vagus area. And so we need to look at the possibility of creating more bulk in the bite, so to say. A few years ago, a client came to me, Vithus from Copenhagen, with chronic neck pain, and she went to the dental high school and had taken off to balance, but that just worsened the whole situation. So she went to acupuncturist to have this chronic pain relieved. She came to me and said, "Well, you have a deep bite. It's totally wrong. You don't have to take off. You have to put on." And what I did at that point, that it was in '93, I took an impression and I put extra composite onlays of about 3 to 4 millimeter to raise her bite. Immediately after that, she was relieved from her neck pain. You could actually, if that was a permanent treatment, because you could have an intermediate treatment like in Skinner, a split, I believe, putting in, so you have a sense of what this treatment could look like along the road. But I just knew I have certain diagnostic tools to register the proper level that I learned from this Dr. Funder. So in a few days, her chronic neck pain was relieved because of the proper bite height. She had a bite, she could feel it in her lower lumbar, she could stand straight again. She was like that because of she had to build up the bite so she could be herself. And the dental high school, they just drilled away just to even out. Yeah. Anyway, there's room for a few questions, and please feel welcome. Yeah. There's a mic coming up. Yeah.
Thank you very much for all this information. I just would like to ask you, you said, and we all know that this fluoride is, how do you say, Methyl förkörteln. It's blocking the hormones to the thyroid gland, so that the hormones can't work in a good way.
Yeah.
Is it true according to you?
That the fluoride will block the hormone, yes, or the hormone
in the thyroid gland.
The thyroid, yeah. I would say from what I have studied, that the fluoride would actually, there's a certain affinity from fluoride to the pituitary gland, which is a overruling gland for our hormonal system. So, but it also works on the thyroid, which will work on your forbrændingsevne. Yeah, metabolism, sorry. So, and it creates DNA damage, cancer. It works on the bones, so you have this bone marrow destroyed. And it's really, I mean, at the end of the 30s, the American need for Second World War, a lot of aluminum production for the airplanes, and they took it, cryoed it from Greenland. And in the eastern US, they had a whole environment catastrophe in their waterways because of the production of aluminum, because a side product of that, a waste product of that production of aluminum for the airplanes was sodium fluoride. And the people were annoyed and rage. And the industry just protected itself and put two SCAPE researchers, or what you say like that, but they took a year to evaluate the situation, and they found out we could put it in drinking water, but it's good for the enamel. And the enamel, I would just like to end on that. I take other questions, but the enamel, when you have a dental plaque, the natural skin of the teeth that you don't rub away with hard dental creams, you actually tend to have a mild toothpaste, adding nutrition stuff like minerals, calcium, magnesium, and other minerals to enrich the natural plaque. You don't see it. It's a very thin membrane, and it takes about 3 or 4 weeks to mature such a dental plaque. There was a huge international conference in '68 with Don Ritchie from Dunedin University as an international figure that had pointed that out in his research in New Zealand at that point. But Colgate University didn't approve that, so they put some CIA activities on into Dunedin via some students, putting fire into his house. He had to fly to Australia. So there was a lot risk of breaking the Colgate monopoly, and how they dictated the whole idea of the carriers going down because of the introduction of fluoride toothpaste. Would you take that? Thank you. So just a few extra comments in that way to you. But I had a question here. And
I just wanted to know, when you have these root canals done,
yeah.
Is there anything you can do to clean yourself from these effects?
Yeah, I would say you can visit a person. We have Bianca sitting here. It could be another person that optimize your excreting capabilities, so that you actually through the waterways help yourself to rid yourself of toxins. So that is also how you're dealing with your heavy metal, for instance. You can take homeopathic remedies. You could take vitamin C. You could take sulfur, like onion and garlic and algae and things like that. That will chelate to the mercury and take it out through the waterways, sweat, urine, and so forth. The outbreath, the exhale. So you can create a detox program that will raise your level of ridding yourself of accumulated heavy metals. Yeah.
Yes, thank you. I'm a metamedicine practitioner,
yeah.
And as such, we.
Could you please raise your voice?
Yeah, okay. I'm a metamedicine practitioner, and as such, we respect the body and our being as being able to do everything itself in the best way. You just have to help it.
Yeah.
So, and we acknowledge the importance of the teeth. At which level would you recommend to move out teeth? Because they have an importance, each of them.
That's quite a good question. Some people come to me, and that deals with the question of root canals. They have read or they have been on the internet, and root canals is a no-go. But they have the teeth has a very profound function in the mouth. As the zones on the feet, they actually massage the reflect points in the body, zone therapy, reflexology. Similarly, in the mouth, if we miss out on a number of teeth, drawn out because of their root canal status, we miss out on the massaging energetically of the body and the organs and the part of the spine, all these areas of the body, tendons, muscle groups, organs, and thereby feelings, emotional patterns. So we miss out on a rich and well-functioning with a proper height, ongoing massage, energetical communication to the whole body. So German dentists say that we can, and doctors say that we can compensate a person with a proper, a proper constitution and an all right lifestyle can compensate for 1 to 2 root canals, where a proper lifestyle, nutritionally and otherwise, can compensate, and then you can keep them. Remember, I told before that even periodontal disease, they create in the deep pockets exactly the same pockets. So it's not only root canals. We're talking about anaerobic activity in deep places, like deep pockets or in jawbone, that hasn't had to pass unattended for such a long time without doing your best efforts to release that situation. Yeah.
In case of dead teeth,
Yeah.
do you think it's best to remove them or let them be?
Same procedure. They have the same status as a root canal, dead tissue, and you could see it. You can see it on an X-ray, but when you measure the cellular vitality in the surrounding bone tissue, you can see it's dead tissue, and toxins are spread in the side channels that you saw from the big molar there. These toxins are constantly produced by very lively microbes sitting there, taking in nutrition from the bone and leaking out toxins like mustard gas. Mercaptans and thioether, that's what we're talking about. Yeah.
Thank you.
Yeah, we're welcome.
Isn't it so that you need a special X-ray apparatus to see these cavities? Sort of inverted X-ray.
To see which cavities?
The cavities after a root canal treatment.
No, cavitations. You need a panorama, which is like that, and then you have to be trained in looking at the cavitations, because there's a very thin membrane along it, and sometimes it will develop into a clear cystis with a more thick membrane. But it can be difficult without proper training. I trained with a German doctor in Australia who attended the same conference as I mentioned in Colorado Springs. He was a master, and he helped his clients with collaborating with a local dentist, identification of the cavitations, having him going to this doctor and having him relieved, and they released a lot of difficult symptoms just from having these cavitations removed. And you could see them at the panorama, you know, the full scale X-ray. Yeah.
Okay, thank you very much.
Thank you.